Friends, I'm Dr. Sanjay Pandey, consultant urologist at the state-of-art Kokalaben Dhirubhai Ambani Hospital in Mumbai. Dealing with each aspect of urological care from A to Z, which includes awareness and positivity to the society in one aspect. To be able to listen to the bothersomeness of complaints across the stable of patients who do come in with various diseases, attempt to treat and cure them is almost impossible to possible today because of the kind of technology and the kind of availability of various gadgets and the various kind of investigations available. While we spread this positivity to individuals, we also look at transforming ourselves into better human beings, carrying passionately the serious hard work that we continue to do and scaling ourselves up on the technology. Embracing technology has been a process of change for everybody in this world. And today we know that on one way, the technology has brought about compression of a lot of things into a more and more minuscule kind of an aspect. Other side, catapulted ourselves to those levels where we feel ourselves transformed. The transformation for me in the last 24 years in the subject of healthcare and then into general surgery and to urology, I owe a lot to my parents, to my teachers, and to the family who gave us this platform to be able to scale ourselves to such heights, to be able to take up challenges of various kinds of work, and to be able to bring about patient care by the very important passion that we now take forward in subjects that we have embraced. One such revolution that I got involved in and could embrace, grasp it so strongly, was robotic urology. Robotics is that aspect of minimally invasive surgery which came approximately a decade ago in the world, where we learned the precision was never like before. We almost scaled the next level of precision in terms of being able to enter through minimal keyholes, to be able to see the organs real time through just holes, sitting far away in a console when the patient is far away, and be able to bring about those precise movements. So in various surgical aspects in the cavities, especially in the abdominal cavity, whereas a urologist, we deal with organs called the adrenal glands. We look at the kidneys, we look at the ureters, we look at the urinary bladder, we look at the prostates. All these organs can be thoroughly dealt with robotic surgery or robotic assisted surgeries in their disease processes. This entire aspect of robotics ignited me completely when I looked at being more motivated and more rejuvenated. And it was great revelation when I went to train myself in Korea for this important aspect. Friends, robotics is that branch, or that kind of a transformation, which has actually brought about so much of extra amount of precision, which we were not able to do with our own hands, even in open surgery. For example, the prostate, which is an organ quite in the depth in the pelvis, could only be reached by a large incision or a large cut, reached there and probably operated with a lot of blood loss and a lot of other aspects, which was known to us in the open era. The open era continues to happen. In that came in this important landmark change or the revolution called robotics. And robotics in urology has actually taken the front seat altogether in terms of being minimally invasive to help us in various aspects of care. It feels really good and really rejuvenated when you take those aspects of attempting towards a futuristic therapy where you are able to cure by very minimally invasive approach. So that I deal with two important aspects in robotics. One is the reconstructive urology or reconstruction of various organs which actually are damaged or injured or obstructed. I also deal with the entire comprehensive cancer care in urology, which includes the adrenal tumors or the adrenal cancers. We look at the kidney tumors and the kidney cancers. We look at the ureteric tumors and the ureteric cancers. We go down and look at the bladder tumors, and then we look at the prostate cancers. All these diseases which develop cancers and are actually localized, and that happens so much by the society being aware of these disease processes in advance, getting their healthcare checkups and probably picking up the right cues. Patients do come from various cities and countries and get treated by the minimally invasive robotic surgery. So for example, in urology, while there are quality of life diseases like overactive bladder and incontinence of urine, there are those life-threatening diseases which are cancers of all these organs are enlisted in urology. The adrenals, the kidneys, the ureters, the urinary bladder, the prostate, and obviously the organs of testis and the penis, which are dealt with more by open surgery, but there are other aspects of treatment on the lymph nodes are dealt by the robotics. So various aspects that we deal today in this important journey of transformation for us as urologists, I think it feels very proud and privileged to be living in those times where dream came true completely. They always say change is very difficult and hard at the beginning, very messy in the middle, and almost gorgeous in the end. And that's what it looks like to me personally in the journey in the last 24 years. That when I chose myself to become a doctor, and possibly that happened, it were difficult days to train ourselves into long hours of educating and reading ourselves on those important books and multiple subjects, which finally were actually pyramidally going towards surgery. It was all quite messy in the middle because you were attempting to look at general surgery on one aspect, getting into urology, training yourself, trying to find yourself a seat in the best medical colleges in the country. And thereafter, once that happened around, you still looked at specializing and super specializing into each aspects of urology care. That is what we're able to give. Robotics comes as a huge revolution for umpteen reasons. Number one, the patient care has improved dramatically. From the era when we used to do open surgery, manifold changes have happened when we do a minimally invasive surgery of the precise kind by robotics. Number one, the recovery of the patient. Number two, the pain and the discomfort, which is almost close to minimal or none. Patients getting up and walking on day 2, day 3 of the surgery, walking out of the hospital by day 4, day 5, and feeling comfortable to get back to life by day 6 to day 10 is quite a boon, something which I'd never imagined. In other words, the true knowledge is not only about looking at what we know, but about the imagination to the next level. And therefore, we all as doctors, after having complaints heard of the patients who come across with various aspects and various kinds of reports that they carry, we look forward to actually rejuvenating them and telling them it's curable, it's treatable. It's treatable by umpteen ways of looking at behavioral changes, looking at therapies which are medical, and looking at surgical therapies. In urology, the surgical therapies have spanned from open surgery to endoscopic surgery and to various kinds of minimally invasive surgery, of which I'm talking today to you of the robotics and the kind of robotic revolution which has happened. The revolution which robotics brought about to me personally is that the kind of precision I could bring in about, the kind of ignition in my mind which happened around when I look at the organs can be seen real time, the organs can be seen as you continue to see and you operate them with so precise the kind of model that you can manufacture in the abdominal cavity. It feels good today to be able to take this to the next level. The next level has been the change where we have looked at the comprehensive care in robotics on both the cancers as well as reconstructions. At the Department of Urology at the Kokilaben Hospital in Mumbai, for the last 6 to 7 years that we embraced this subject, we looked at each of these disease processes to be taken to the extremely next level, which is a level of cure. Robotics has therefore been completely a revolution to me in terms of picking up something which I never did before. I was an endoscopic surgeon, I was an open surgeon, I was a reconstructive urologist, and to bring about all these amalgamations into a minimally invasive approach, which gives me a precise nature of care and control, which helps me to probably bring a smile to a lot of faces and to bring about the aspect of cure. I think robotic urology has transformed us completely. While we look at robotics bringing about a transformation to the quality of life of individuals by a minimally invasive surgery, which for the surgeon is so precise that he is able to clear the margins very closely from the nerves, from the vessels and adjacent organs. It feels really transformed, as I said, on aspects that I am able to bring up on two important aspects of surgery in urology. One is called the reconstructive robotic urological surgeries, and one is called the ablative or the cancer surgeries, which I continue to do all 7 days a week on various aspects which actually are localized diseases. Coming to the cancer surgeries, which we do in robotics across the country and the world, and back in the Department of Urology at Kokilaben Hospital, are the surgeries of the adrenal glands called the robotic adrenalectomy. The adrenal glands could be removed for the pheochromocytomas, could be removed for the cancers of the adrenal glands, which are quite deep placed under the rib cage, and it's now easy to manipulate ourselves, reach that location which was not reachable before unless we used to do a long cut. So robotic adrenalectomy or removal of adrenal masses and adrenal tumors, could it be as large as 10 to 15 centimeters or small as 2 or 3 centimeters, could easily be approached all the way by the robotic arms being able to reach to a precise location, identify, localize, remove the adrenal gland as required. Major part of our surgery happens on the kidneys, where we pick up early kidney cancers today as a result of various health checkups and ultrasounds. A kidney mass which is heterogeneous or a kidney mass which is probably picked up as a mass that is malignant is taken up by a robotic surgery called as robotic radical nephrectomy. Radical is a term used for a cancer care where you have a localized disease and you're able to remove the complete organ along with its lymph nodes and therefore bring about a cure. That attempt in a very small kidney mass today is called as a robotic partial nephrectomy. That means only precisely a part of the kidney is removed and the left of the kidney is left over. While doing a robotic partial nephrectomy, we necessarily remove the entire organ with a sliver or a margin of the tissue and check on a frozen section that there is no margin positivity left over. While doing so, we look at revising sometimes as needed on the operating table. And that kind of precision, cutting layer by layer, millimeter by millimeter, is possible only by robotics, helping us to reach that area, localize the tumor, take care of the blood vessels temporarily clamped, remove the tumor and reconstruct the entire kidney, and then come out with the specimen. Friends, the kidney surgery has grossly being revolutionized because of robotics and the precise nature of work, only because we are able to reach with the robotics to those levels around. Coming down in the ureter, we removed ureteric masses and ureteric tumors by a robotic ureteric excision and then doing a repair or a reconstruction. But in the urinary bladder cancers have got revolutionized. They may take a little longer because of the ports that we use around, but that is only getting better and better with passing time. At the end of it, these are keyhole surgeries with absolutely precise approach, where robotic radical cystectomy for a bladder cancer and reconstruction of that, or robotic diverticulectomy for a huge diverticulum can now be taken up by a way of robotic surgery. Prostate or prostate cancer, which actually is a localized disease, can be done by robotic radical prostatectomy that I continue to do few per week, few per month. And this happens only because we pick up early prostate cancer. We're sitting in September, the prostate cancer awareness month, and the positivity today is only awareness is the best way to pick up things early, and early management is the key to success to bring about a therapy that is called cure. To bring about a cure in the prostate cancer, in the past it was a long open cut and we used to reach there. Obviously it is a location where there's so many nerves and blood supplies and there was a lot of blood loss in that past. Gone as those years, and now we have got the robotic radical prostatectomy as an attempt towards cure, where we go very precisely along the capsule, spare the nerves in cases where we need to spare them, go very closely to the organ called the rectum behind, and go very close to the sphincter in an attempt to completely remove the organ along with the lymph nodes and bring about a reconstruction where we do our psychourethral anastomosis and join the bladder to the urethra along the continence mechanism and let the urine flow, and therefore he gets a cure. So in cancer care of the adrenals, in cancer care for the kidney, in cancer care for the urinary bladder, and cancer care for the prostate, I think robotics has come as a boon as a minimally invasive surgery, sitting in a console far away from the patient, where the patient is having minimally invasive various ports that are moved around from the console in a very precise manner. And the entire team takes care of this to a different level altogether. So robotic cancer care has actually come to stay, and over the last 6 years, transforming myself from an open surgeon into a robotic surgeon has been that revolution, which I feel very comfortable right now. When we look at the reconstructive urology, always was an era where you wanted to reconstruct precisely something which has gone wrong. For example, we used to do an open pyeloplasty. Now is the era of minimally invasive pyeloplasty by robotics, where we reach that pelvis, which has got a very narrow pelvic-ureteric junction, and precisely we are able to repair that, called as pyeloplasty. So robotic assisted pyeloplasty has been done for the last 7 years here on patients who are children, on patients who are adolescents, and adults who presented with a hydronephrosis, an obstructed kidney, where the ureter congenitally has been narrow at the beginning or at the summit, where it is called a pelvic-ureteric junction. Robotic ureterostomy for the strictures of the ureter or narrowings of the ureter, which happen because it could be a narrowing as a result of a long-standing stone. The ureter has undergone a stricture. We do a stricture repair by a ureterostomy in removing that stricture segment. So gone are the days where you get recurrent UTI and pyelonephritis because the ureteric stricture could not be handled. Now, the open surgery may not be required if you could very precisely, with the kind of technique that we have evolved into, being able to take it to the next level. When we look at robotic ureteroneocystostomy, we are actually implanting the ureter into the bladder, where the lower part of the ureter is diseased. The lower part of the ureter could actually be narrowed, could be tightened up because of various surgeries or various kind of disease processes. And the ureter therefore could be brought again into a new opening into the bladder. It's called as a ureteroneocystostomy, can be done robotically. We've also done robotic Bovary flaps, a little challenging surgery where we want to construct the lower part of the ureter. That challenge only gets bigger and bigger as the disease processes which come to us are bigger challenges. Friends, we do robotic vesicovaginal fistula repair, VVF repair, where the urine leak in the vagina is happening from the bladder as a result of an abnormal communication or a fistulous tract, which has been created by various aspects happening in gynecology. So vesical vaginal fistula or urinary leakage from the vagina can be treated completely robotically, where we go ahead and treat it by a robotic approach through the abdomen, reaching the pelvis, dismantling the vagina and the bladder fistula separately, repairing both, and then probably bringing up momentum and implanting it there. That I'm involved in vaginoplasty of two kinds. One is MRKH syndrome, Mayer-Rokitansky-Kuster-Hauser syndrome, where a girl is born without a vagina and without a uterus. We create a completely new vagina from the sigmoid segment, and a similar kind of work we do for transgender, where we do a sigmoid vaginoplasty. In the open era, we used to open up the abdomen and choose the appropriate segment of the sigmoid colon, which is a tubular structure on the intestines, and bring it with its blood supply in the pedicle and approximate it to a location which could be the region of the vagina behind the prostate or behind in front of the rectum, that location which actually is missing of an organ. So in women who are born without a vagina, which is called as vaginal atresia, or in women who are born with MRKH syndrome, where there is no uterus and no vagina, they would only be complete when there is a vagina creation of it. So in adolescence, girls do come in with hematometra, or they present with an absence of menstrual periods after the age of menarche, and they're picked up as MRKH syndrome. We do a vaginoplasty for these girls, who therefore have an organ called vagina, and they're back as a woman completely. Probably because they did not have an organ that was missing completely when organs were distributed at birth. On the other side, because we do gender reassignment surgery, we do a penile inversion flap as an open technique. The sigmoid vaginoplasty, which was always looked at an aspect of a secondary care, has been chosen by many intellectuals and transgender patients across the world who request for a sigmoid vaginoplasty. From an open surgery to a sigmoid vaginoplasty by a robotic route, we were able to take it forward to the next level. While I was talking about bladder on the cancer aspect, we do bladder augmentation cystoplasty or reduction cystoplasty by a robotic route. That again is about reducing or increasing the capacity of the bladder in a very small capacity bladder, which could happen because of tuberculosis or interstitial cystitis. And on the other side, it could be very large, huge bladder capacity, could be a few liters like the one we operated recently. Finally, we also do various kinds of surgeries where we do robotic uretrolysis for Ormond's disease or retroperitoneal fibrosis, where the ureters are getting compressed into fibrous tissue and do an omental wrapping all around it. These required long cuts and long incisions in the past and could be very precisely done over the last umpteen patients in a robotic approach. Friends, robot is a revolution in our lifetime, which actually helped us to go to a minimally invasive approach to bring about care and cure of patients who were otherwise scared of surgeries. Surgery has become much more acceptable to patients when they understand the reality about what as a revolution, as technology that has come forward. So bend is what we need to do, bend about to bring about a change. And the change that we had brought about has allowed us to negotiate those very sharp bends in our careers, where very difficult surgeries have actually been polished and practiced and have come to such levels only by a minimally invasive approach. Robotics have come to stay. There are those minimally invasive approaches where various kinds of reconstructive urological work and various kinds of cancer urological work at the Coquelin Hospital, where we continue to do that in Department of Urology. It feels proud to be able to do all these treatments to various patients in various age groups. And it feels good today that these patients go to the level of cure. Friends, robotics will continue to stay. We need to look into how to get ourselves aware about diseases, pick up diseases early. I always say prevention is better than cure. But if you are requiring a cure, then the cure should be minimally invasive, should be less or least painful, at the same time recover in the best possible way. With those positivities, I leave you today. Looking forward to getting more awareness on various aspects of urology, of the subject that we practice, as we climb this ladder and pyramid of evolution into newer technologies and newer ways to treat, following the Hippocratic oath all the time that first do no harm. And that's how doctors think. Thank you so much.